Ojeku. This is a gas-centric breakfast show this morning. Oyi Waladon for staying with us. Achomi na Maltiti Saida Sadiq. And so before we cross to the palace, we're bringing you the health segment this morning. And my guest, just before I tell you the details of what we'll be discussing, is
Achomi ni Anan.
Oyi Waladon. Ojeku. And this morning, we're going to be discussing maternal health as a critical aspect of healthcare, focusing on the well-being of women during pregnancy, childbirth, and postpartum period. And in this segment, we'll explore key issues affecting maternal health, including access to quality care, common complications, and ways to improve maternal outcomes. And as my guest has introduced himself, Dr. Richardson Edwin Annan from the Pentecost Hospital is my guest this morning. Doc, good morning. Maternal health issues, very critical. I did see a report about Cape Coast Hospital and the numbers that they have recorded, and it was quite alarming for 2024. But what are the factors we would say that define maternal health? And do endeavor to watch us on social media. We're streaming at GTV Ghana on Facebook. Doc, you can go ahead.
Good morning, and then once again, I'm happy to be here. Yes, like you rightly said, the numbers are alarming. Just some few days ago, we realized that, or we saw that even in Ashanti region from 2020 to 2024, we are close to like 1,000 deaths. 1,000 maternal death, which is very
2022 to 2024.
2020 to 2024, close to like 1,100,000 maternal death, and it's very, very alarming. And we want to say or put across that pregnancy is not a disease. So anyone who gets pregnant should be able to go through the period of pregnancy, deliver safely, and then have good health for herself and that of her child as well. So pregnancy is not a disease, meaning that there are so many factors that come into play when you conceive throughout your pregnancy period to the time that you put to bed. So like you rightly said, maternal health would encompass the health of an individual, health of a woman during pregnancy, childbirth, and then postpartum, and then even from infancy to adolescent age. So that's just about it. And then we have so many causes or factors that affect our maternal health. So to begin with, if you want to talk about the issues that is increasing the death rate, hemorrhage is on the number one. When we say hemorrhage or bleeding, it could be antepartum or postpartum. So antepartum would mean that the woman is still pregnant, and then the pregnancy has not gone beyond 28 weeks.
Okay.
So you are bleeding in pregnancy, which is not normal. So we want to say that any bleed that you see, any kind of bleed at all, whether sustained or just spotting, whilst you are pregnant, it's not a normal thing.
So why would you bleed? Why would a pregnant woman be bleeding?
So there are a number of factors that can cause bleeding in pregnancy. So in early pregnancy, a common urinary tract infection can give you bleeding in pregnancy. Okay. Abortions can give you bleeding in pregnancy. And to say in abortions, we have what we call spontaneous abortion. So it's not something that the individual or the woman has deliberately taken something to abort the baby, but it could be like your cervical insufficiency, anything that could let the baby come out. So there are so many factors. So when you are seeing blood, it could be abortion. When the pregnancy has crosses the viability period, like in Ghana it's 28 days, but in advanced countries like 24 weeks. Okay. A fetus can actually survive outside the uterus from age 24 weeks and above. But in Ghana, because of lack of resources and other factors, our viability period is even after 28 weeks. And even with that, we fall short in one way or the other. Right. So when you are bleeding, other abortions, or like I said, antepartum hemorrhage, which mostly is a placenta abruptio or a placenta preview. When I say placenta abruptio, you realize that when you get pregnant, so there's a placenta, it becomes a channel through which food, nutrients, blood, other things
oxygen
go
through,
the baby. Yes, from the mother to the baby.
Right.
So it's more like an attachment. So when the placenta detaches itself before conception. It means that it has, before time, it can lead to bleeding. That's an abruptio. Then again, the presentation of the placenta is always behind the baby. In most times, the presentation comes before. That's why we say previa, before. So in cases like that too, you are likely to have bleeding in pregnancy. Then you have to come to the hospital. When we say postpartum hemorrhage, then it means that you have put to bed, you have delivered, and then you are bleeding. So when you deliver vaginally, like the natural way, we don't expect you to bleed more than 500 mils. That is like the bottle of water. And when we do like a cesarean section for you, we don't also expect you to bleed more than 1,000 mils. That is two of this. Yes. Or we don't expect any bleeding to cause what we call hemodynamical instability, so that you exhibit signs of low blood in your body. So you are respiring as quick as you can because you want to catch your breath. Your pulses are on the roof. Your heart is beating as much as you are tired. You cannot. Some people even sweat. So that means that
because there's not enough blood.
Exactly,
in the body.
there's not enough. So the little blood, the body is trying to circulate it. Exactly. So when you have that, then we say you have what we call a postpartum hemorrhage, and hemorrhage is one of the leading causes of maternal deaths across the world and even in Ghana. I want to put this across. In 2020, the World Health Organization put out a number of 287,000 deaths across the world, maternal death. That is in 2020. In Ghana in 2020, we had recorded 310 deaths per 100,000 births. So it was even an improvement to what we had in 2019, which was 710. So in 2020, we had improved, but I'm sure from 2020 to 2024, like you said, from Cape Coast and from what we are hearing from Ashanti region, if they bring out the statistics, the numbers will have been up. So coming back to the causes, so from hemorrhage, we go to abortions.
Okay.
Abortions too are causing a lot of maternal death among the pregnant women. Abortions, we have one that you would initiate yourself, and mostly it's due to the fact that they don't want the pregnancy, or the pregnancy was not planned, so they want to abort the baby. And like I said the first time, we have what we call the spontaneous one. It comes by itself naturally. Right. Your cervix must not be must be insufficient to hold the
How common is the spontaneous one, though? Because for the one that is induced by themselves, we do hear about it, and it almost seems like when you think of an abortion, you think of death, that the person is not going to survive it.
So the spontaneous one is rare, but it happens. But I mean, factors like infections, so like you have a bad urinary tract infection, or anatomically predisposition, your cervix or the nature of your uterus, your cervix is not strong enough, it's not sufficient enough for it to be closed during the pregnancy. But most likely it's infections. Infections are causing a whole lot of spontaneous abortions. Okay. And the ones that, they decide to take, most people will not even go through the right channel to terminate it. I've come across a number of cases that will come to the hospital bleeding, and they have visited places, they have given them some tablets, and they are supposed to be taking the tablet every 2 hours, every 3 hours, which is causing a whole lot of damage to the body or the system. Right. So abortions are also up there. Then we come to what we call hypertensive diseases in pregnancy.
I wanted to ask the BPs.
Yes. Unfortunately, the body goes through changes, physiological changes during pregnancy. And as part of those changes, hypertension is one of the things that you can actually develop during pregnancy. And this is even easy when you are less than 18 years or more than 35 years. So every pregnancy comes with its own risks. But when you are below the age of 18 years, your risk increases. When you are above the age of 35 years, your risks also
now I get why women are encouraged to have children.
Yes, so we encourage that between age 18 years and 35 years, if you want to give birth to 3, 4, 5, 6 children, have them
rest by 35.
Exactly, rest by 35 years.
Wow.
Yes, so hypertensive diseases too are also up there. Then we'll move on to cases of antenatal. So people would not come to
the
hospital at all. They will not come to the hospital. So, and that's, there are a number of factors. It comes from accessibility to health, to financial, socio-economical factors.
So before you go on, I wanted to read the report that I saw on the Cape Coast Teaching Hospital. Okay. I mean, we're talking about the coastal area. So maybe, I don't know if you have a purview of how Accra is with maternal health, but in Cape Coast Teaching Hospital, they did say that the maternal mortality ratio stood at 863 deaths per 100,000 live births in 2024. And it's indicated that for every 100,000 live births, 863 mothers died due to various issues, complications related to pregnancy or childbirth. And it also recorded a neonatal mortality rate of 40 deaths per 1,000 live births, which indicated for every 1,000 newborns, 40 died within the first 28 days of life. And that's worrying.
Yes, very, very worrying. So
access to the healthcare facility, but in the cities. So let's say that's the rural.
Yes, the rural areas.
Okay.
In the cities, it might interest you to know that there are some of the things you may expect them to be happening in the rural areas. They are happening in the rural.
They don't want to go to hospital.
They are happening in the cities as well. So issues with gender inequality.
Okay.
So you realize that in most homes, the man has the say.
The deciding power.
Exactly. If the man says don't go to the hospital, you don't go to the hospital. So we've had a case that came to the hospital at 9 months. And she had never visited the hospital.
Wow.
Never. And the reason she came to the hospital was the whole legs had swollen to the point where they cannot contain again at home, so they had to just push her to the hospital. And she conceived, and she had never gone to antenatal. The BPs were on the roof, and this is somebody living in Accra. Yes, in the city. So a whole lot of things are happening, not in the rural areas, in Accra as well. So we expect that once you test positive for pregnancy, in the first 12 weeks, we want you to make your first antenatal visit.
Okay.
And now, these days, there are so many policies. Now we have moved to what we call the focus antenatal. The focus antenatal, we are looking at the risks with respect to your pregnancy and not pregnancy at a whole. Like, so you individualize care. And in this focus antenatal that I'm talking about, you are assigned to one midwife. So it's a midwife who is going to take care of it from the first time that you visited the hospital to the time that, so then it makes it easier for you. I know you. So when you come, I don't even have to go through your book to see, because I know history. Exactly, I know your history.
But what are the ratios like? Because if every pregnant woman is going to have a midwife.
Yes, that's so I was going to come to that. It comes down to the numbers as well. The numbers, like with health staff, to the it's really, really, really low. I mean, it's really, really low. So I mean, we are overwhelmed at the hospital. You go to an antenatal clinic and then you stay there forever, because I mean, they don't seem to stop coming. They come, and those who would come for the visit, I mean, at Pentecost, we see a number of antenatal cases. And when you are a doctor at a post or a midwife at a post, you are not seeing a midwife, you are not seeing less than 100 people in a day. That's in total, yes. So, I mean, the numbers are there, but then the number of health workers are really, 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 really low. And we know that there are lots of midwives and nurses at home waiting to be posted, and it comes down to the government, which we can't go there, because we are hoping that they will come and join us so that then we'll deliver the help. Then again, finances. Even though there's free maternal care, there are petty things that as a mother you should also buy. And you see, when we just don't give healthcare, but even at the hospitals, we are buying things for pregnant women and their babies, because mothers will come and they have not even prepared. So what we do is that not at all, nothing. What we do is that once you make your visits, and once your pregnancy is progressing, we'll give you a list of things that you will need for childbirth. Things for yourself and for the baby and all that. And some people, even with the fact that we are providing free care when they come to the hospital, to even get the things to come to the hospital, they would. So they wouldn't even come to the hospital at all. They would prefer, they want to stay in their house. And then traditional cultural beliefs. You understand that in the past, I mean, mothers were used to giving birth at home. We had traditional birth
and it's still
attendant.
happening in 2025, isn't it?
Exactly,
Yes,
it's still happening. We have traditional birth attendants who have gone through some sort of formal training, even though they've not gone through like the entire training, but then they have some training with respect to childbirth and the things that they have to do. But you see, when you come to the hospital, you are better prepared, because in case of an emergency, we can
like
rightly,
a breech birth and all of that.
exactly. So they believe that, oh, I delivered 10 children at home and I didn't go to the hospital, I was fine. So you see, people want to tell other people, because they have done that, they don't want you to come to the hospital. But then we also want to say that every pregnancy is different, every pregnancy. So if you're a mother who've had like 2-3 children, you would understand that what you went through with your first pregnancy is different from what you went through with your second pregnancy. So pregnancy is not such that you will say that, oh, I have delivered 2, I have delivered 3, so I have the experience.
You have the same expectations for this, you know.
Not at all.
I work with fistula, women with fistula, so I do understand this. And in rural communities where, as you said, the man has the deciding power, so they don't go to antenatal forever till they're giving birth, and then some too who go and or give birth at home, there's no cesarean section and all of that, and then they're leaking.
Yes.
How expensive is having a CS also? If the normal birth is free, is cesarean also free?
Yes, the truth is that cesarean is actually free. It's covered by the National Health Insurance.
Okay.
But then again, even on the insurance, there are some medications that you would have to pay or do what we call like a top-up. So, of course, the procedure and everything is free, but the medications, some of them, is not covered by the health insurance.
Right. So,
you have to. And so what I have realized in practice is that even with the health insurance, it differs with the level of facility. Okay. So we have primary, secondary, tertiary facilities. So there are some things that the health insurance will take care of entirely at the primary level. But when you go to the secondary level, you do something like a top-up or something. When it comes to the tertiary level, it might not even work for all the things at all. Exactly. So the insurance bit, it's an area we also need to understand. Because when I was a student, this happened in Cape Coast. Someone went to the cafeteria, the canteen, to eat. And then he said he had insurance. Yes, and he didn't know that the insurance wouldn't cover the food. Exactly.
Oh, goodness.
So this is not even, you see, so the education must, go out there with respect to the insurance. So when they come and we are telling them to, buy or they will pay for some of these things, it becomes a challenge. Because in their mind, everything is supposed to be free, exactly. But then it is not so. It is not so. That's what we are told. Because, I mean, in the hospital, we have people that manage the insurance bit. Us is to just, provide the service of the healthcare.
So since you mentioned Cape Coast, you've lived or worked in Cape Coast, schooled in Cape Coast?
Yes, I've lived, schooled in Cape Coast. I think I lived in Cape Coast for a while, how many years? From, I think, 3+ years.
Okay, did you have an understanding of why they have the maternal health issues there as well? Because I hear there's high teenage pregnancy, and
so
we're talking of coastal communities.
You realize that the coastal belt, there's a lot of...
in the gang communities.
I'm coming from a coastal belt myself, yes. I'm coming from a fishing community. Right. So the teenage pregnancies are really, really high. Very high. It boils down to the fact that, you see, that's our only source of income. So they go to the sea or the beaches, and then they are lured by the fishermen with all these,
because they have the cash.
Exactly. And then even for those who are married, and the understanding is that there's no source of entertainment for them. So sex becomes the only source of entertainment among them.
Wow.
So even for those who are even married, you realize that the number of kids, they don't understand family planning. They don't want to even heed to your education on family planning. So they are just getting their women pregnant every time. So the numbers are really...
So the education, is it? Because I would be thinking this is close to the city,
Yes.
So maybe the education or exposure is much better?
The education, I can say we are doing.
Okay.
Education we are doing. But you see, it also comes down to, I feel like in
way
the
of life?
communities, they should enforce some laws, some rules. You see, that would, one way or the other, stop men who engage
In the
in,
teenage
sleeping with
okay.
teenagers. Because, I mean, in the schools, on television, on radio, and even we have a bit, the public health bit, they do home, like house to house.
Yes, I was going to ask. I see it in the hospital, but so they go to the communities.
They go to the communities, they
Wow.
go to schools. So the education bit, I think we are doing well with that. We are actually, even in churches, they are still,
talk about it.
exactly.
Okay.
So I think that in the community where these things are happening, like the fishing communities, the leaders or the chiefs, they should come out with some sort of rules or laws that will one way or the other prevent men who are engaging in sleeping with teenagers to stop. And also, and we want mothers or parents to have sex education with their children. It's something we should encourage, because if
That's
you don't
topic.
exactly, if you don't talk to them, they fall into wrong hands, and then you might not know what they will tell them, and they'll get themselves pregnant. Once they are pregnant, some of them, they can't come to you because they fear what you will do to them.
Right.
So we want to encourage parents to actually start having this kind of conversation, because now the exposure is that there's
It's there
social
already.
media. I mean, friends who come, who are from different backgrounds, come to school, talk to you about certain things. If you are not exposed to those things in the house,
You'll be
you get to you get to hear them from school. So we want to encourage parents, start having sex education with your kids, and then and be open-minded, so that your child can actually come to you when I mean she gets herself pregnant. Because again, people might not support me on this, but I think that pregnancy is a choice. And when you are pregnant, it's your choice to keep it or to terminate it. And because we would rather you would go through a safe pregnancy than go, through something that would eventually, end your life or lead you to some complications in future. So we want to encourage mothers, parents, fathers especially, to be open-minded with their kids, so that they can get close to them if they get themselves pregnant. And again, the use of condoms, contraceptives, family planning, I want to put it out there, because that is one way to prevent unwanted pregnancy. And that's when we hit to that, we'll decrease the numbers with respect to maternal deaths. Yeah.
Let's end by partners as well, with our parents or our mothers, couples. What role should partners play?
Okay, so I think that partners should be very supportive, very, very supportive, and then understand that once, especially the wife or the girl or the woman, when you are pregnant, the changes come. So fathers or husbands should understand that at that point in time, the wife needs all the support. One of the things that I want to chip in, the causes, there's delay in accessing health care.
Okay.
So there's even delay when you get to there. So you see, there are 3 delays. So the pregnant woman and the people around them, they will delay in making decision that this is the time I have to go to the hospital. Now, when they have made a decision, there's also a delay in moving from their house to the hospital. Now, when you come to the hospital, we also fall short in one way or the other. So there's the delay in providing you with the care that you need. So these 3 delays are also, so we want partners to make the decision
early,
as soon as possible, and support their wives. So then at antenatal, we teach you danger signs. So any time at all that you feel or you hear or you see anything with respect to your pregnancy, come to the hospital. I just want to chip in this. Just today is what, Monday. So just Friday, I just gone to work, and this pregnant woman comes with low abdominal pain. We had to scan, and then unfortunately the fetus was dead. And then she felt this at dawn, 1 a.m., and she thought that she could sleep over and come to the hospital in the morning. So you see, If she had come earlier, I mean, we would have been able to save the baby.
The hospital runs 24/7.
24/7. As for pregnant women, we don't joke with them at all. So let me tell you this. So when we lose a pregnant woman, it goes from the first doctor or the first midwife that saw, you go through the vetting process to the last person that saw before. So, there's a whole mortality thing with pregnant women. You cannot do anything at all with pregnant women. So then they have that power, they have that right. So we are supposed to take care of them and take care very well. Yes. Yes.
Wow. I mean, that's why it seems like pregnancy is such a huge responsibility, and so you prepare for it.
Exactly.
You're adequately financed to some extent, and then you heed to all the advice. Shout out to the Achimota Pregnancy School. I see some facilities have schools.
Yes,
they are dancing with the women.
A lot of hospitals are actually
having pregnancies, and the men too. I mean, the husbands, the fathers, they pass through. Thank you so much, Dr. Richardson. Lots we've talked about. Doc has advised sex education early with teenagers as well. The coastal communities in Accra, where today we are having a gas-centric breakfast show, Cape Coast, where the maternal mortality numbers can reduce with the education and the conversations with the young girls and some of our cultural practices that are not helpful. Chiefs and opinion leaders, Dr. Annan has, made a clarion call that they put some stringent measures in place to prevent these teenage pregnancies and for our mothers to go to the hospital early to avoid the hemorrhages, the high BPs, the fetus, the child is not well. Go immediately. The hospital runs 24/7 and the care is free as well. And so our husbands, make your deciding power, at your decisions early to save our mothers. We've been talking about improving maternal health care challenges and solutions at Chomi Na Maltiti Sadek, and my guest has been Dr. Richardson Edwin Annan, Medical Doctor, Pentecost Hospital. Doc, thanks for coming.
Thank you.
Remember that the show is live from the Manche Palace, and so Kafui Thelma and Valerie J. were all standing by to bring you the best of the